CPC-COMONAL from BSN1 11K. And for today, I am going to perform or conduct a history taking or nursing interview and general survey. Obtaining a valid nursing health history requires professional, interpersonal, and interviewing skills. The nursing interview is a communication process that has two focuses: establishing rapport and a trusting relationship with the client to elicit accurate and meaningful information, and gathering information on the client's developmental, psychological, sociologic, sociocultural, and spiritual statuses to identify deviations that can be treated with nursing, and collaborative interventions or strengths that can be enhanced through nurse and client collaboration. So the nursing interview has three basic phases: the introductory phase, working phase, and the closing and summary phase, or also called the termination phase. And general survey. This is the first step in the head-to-toe assessment. So it involves observation of the client's general appearance, level of comfort, mental status, and measurements of vital signs, height, and weight. And it is often done simultaneously while taking the patient's health history. And it also requires here for the nurse to use all of her observational skills while interviewing or interacting with the client, because these observations can lead us to clues about the health status of the client. And the outcome of the general survey provides us, student nurses or nurses, about the overall expression of the whole being of our client. And the general survey includes observation of the client's physical development and body build, and the gender and sexual development, apparent age as compared to reported age, and the skin condition and color, dress and hygiene, and posture and gait, level of consciousness, behaviors, body movements, facial expressions, speech, and also the vital signs. And now, before we jump in the introductory phase, it is important to remember that we need to review the medical record of the client before meeting the client. This is actually the pre-introductory phase. And today, as for me, since this is my client's initial checkup and or consultation here, so we don't have an existing medical record under his name, or we don't have a medical record of him. And including in this phase, the pre-introductory phase, is preparing the necessary equipments. So I already have prepared here a functional pen, a medical record sheet for recording the information and for taking notes, and of course a sigmo-manometer and stethoscope for obtaining blood pressure, a digital thermometer for obtaining body temperature, and a wristwatch with a second-hand sweep for obtaining the pulse rate and respiration rate of the client. And of course, performing hand washing. So prior to the conduct of the interview, I have already performed thorough hand washing. Okay, now we are good to go to the introductory phase, where I introduce myself to the client, verify the client's identity, and explain the purpose of the interview and discuss the types of questions that will be asked, and explain the reason for taking notes, or let the client know that you will be taking notes as you speak with them, and ensure client's privacy. Okay, good day, ma'am. I am CPC-COMONAL, your student nurse for today. Okay, please state your complete name.
Bernadette G. Comonal.
Okay, and your birthday.
March 19, 1876.
Okay, how would you like me to address you?
Just call me Nadette.
Okay, Nadette, so I will be interviewing you first. So I'm going to be gathering some information from you. I've been sent here by Head Nurse Ramos to do that as part of our training as a student nurse. And I'll be taking the information that I'll be gathering here later to Dr. Villanueva, and Dr. Villanueva will see you then after that. Would that be okay with you?
Yes, it's okay with me.
Okay, and of course, interviewing you so that I'll be able to know about your health status, and by that, so I can help and assist you with your medical needs. And of course, for me to be able to create a individualized care plan for you. Okay, Nadette, so I'll be asking questions about your health status and background, and some of your personal information or personal circumstance. Would that be okay with you?
Yes.
Okay, and as so you know, I'll be taking down notes for documentational purposes. And depending on how you respond to the questions, it could take about half an hour. Okay, now assess for any potential barriers to communication, such as client's age, as age affects and commonly shows all body systems in varying degrees. So it is important to remember that when you are interviewing an elderly client, so you must first assess his or her hearing acuity or the client's ability to hear. And of course, languages, as your client or the client may doesn't speak or understand your language or the language that you are using. And if the client can actually speak. If these are the cases, then we will be needing an interpreter. Okay, Nadat, are you Cebuana?
Yes, I'm Cebuana, I'm Bisaya.
I'm actually Bisaya food, so do you want me to speak in Bisaya or in a different dialect?
You can continue to ask me in English, and I can answer you in English or Filipino, Bisaya or Tagalog.
Okay, so I have your permission that I'll be continuing to speak with you in English and you will be answering me in English and Filipino or Bisaya. Is that right? Did I get it right? Okay. Okay, so don't hesitate to ask if you have any concerns or questions. And I assure you that all the information that you will be sharing, the confidential information, will remain confidential. Okay, and now I'll just make sure that the door is closed. Okay. Okay, for your privacy and of course for us to be free from any distractions. Okay, now the door is closed. Okay, the next part of the interview, we are now good to go to the working phase or where the data collection or data gathering occurs. It is usually structured with specific questions for primary acquiring for relevant information on the client's first biographic data and the reason for seeking care, history of present illness, past health history, gynecologic and obstetric history, family history, psychosocial history, and current lifestyle. And it is important also here in the working phase that we must know that in a client interview, it involves two types of communication, the nonverbal and verbal communication. And there are several special techniques and certain general considerations that improves both types of communication and promote an effective and productive interview. And this includes as in nonverbal communication is as important as verbal communication. So here we must consider our appearance, demeanor, posture, facial expression, and attitude as it strongly influence how the client perceives the questions that we ask or you ask. And of course, in an effective verbal communication is essential in a client interview. And there are several types and techniques to use here during an interview. We can utilize the open-ended question, close-ended question, and laundry list, rephrasing, well-placed phrases, inferring and providing information. And of course, before we start, it is also important to note to start the interview with open-ended questions, as it allows a full freedom of response of the client. And it is also used to elicit clients' feelings and perceptions. So this type of questions is important as it requires more than one word response. So therefore, it encourages description. So using open-ended questions may reveal significant data about the client's health history. So with this information, now we are good to go to the starting the working phase. Okay, so starting with obtaining about the biographic data of the client. Okay. Okay, Nadet, how have you been feeling lately?
I'm feeling okay. Besides that, I have experiencing pain with my left knee.
Okay, I see. So before we will talk about that, so I'll be obtaining your biographic data or some of your personal information. Would that be okay with you?
Yes.
Okay. So I already have here some of your personal information, including your name, your birthday, and your contact information. So to start with, can you tell me what gender you yourself identify with?
Female.
Okay. And what is your preferred pronoun, he or she?
She.
Okay, and how old are you?
I'm 46 years old.
Okay, and what languages do you speak?
I can speak English and Filipino language.
Okay, and now can you tell me about your relationship status?
I'm married.
Okay, and is your partner or husband here with you today?
No, he's not around. He's working right now.
Okay, and how long have you been married?
20 years.
Oh, do you have any kids?
I have only one daughter.
May I ask, how old is she?
She's 19 right now.
Okay, Nadette, what is your occupational status?
I'm housewife.
Housewife. Okay, what is the highest level of education that you've been completed?
College graduate.
Okay, college graduate. Religious preference.
Roman Catholic.
Okay, Roman Catholic. Okay, that's all the questions that I want to ask regarding to your biographic data. Okay, most of the questions for acquiring biographic data, especially for acquiring the information that identifies the client, including the name, contact information, birthday, gender or sex, occupation, and etc. Asking for those questions actually provide us a baseline information of the client's level of consciousness, memory, speech patterns, articulation, or speech defects. So if she hasn't been able to answer those questions, then she has a cognitive or neurological deficits. And also asking for the patient's age, because this actually, the answer to this question establish a baseline for comparing appearance and development to chronologic age. And also, I have observed that the client appears as his stated age, and also the client is alert, oriented, and attends to the question appropriately. And also, she maintains eye contact, and his facial expressions are appropriate in the situation. Is well groomed as his hair is brushed, and she also has a makeup on, which is appropriate with her age. And also his clothing is appropriate with her age. The next part of the interview are the chief complaint and the history of present illness. Chief complaint, otherwise known as the CC, this is the client's reason for seeking care. So this is what prompted the client for admission or checkup. History of present illness, otherwise known as the HPI, this is where to explore the chief complaint in more detail. And there are mnemonics for acquiring HPI. There are the PQRST, cold spa, Licora, and other methods. And for today, I'm going to use the cold spa mnemonic for acquiring the HPI of my client. Okay, Nadette, now can you tell me what brings you here today?
I'm here today because of the pain that I am experiencing at my left knee. Whenever I'm going to attempt to stretch, I'm having difficulty of walking, and it burdens on my daily house chore.
Okay, and before we talk about more about that, is there anything else that you would like to go over with today?
No.
Okay, and now tell me more about this pain. Is it dull, sharp, radiating, or throbbing?
It's a throbbing pain that acts randomly throughout the day.
Okay, when did it start?
A week ago.
Okay, can you point exactly to where the location of the pain?
The pain wraps around surrounding my knee.
Okay, and does the pain go up or down your leg or anywhere else in your leg?
No.
Okay, and you described the pain is throbbing. Is there anything else about the pain, the quality of the pain that you want to describe for me?
No.
Okay. And now, I would like to know about the severity of the pain. On a pain scale of 1 to 10, 10 being the worst pain that you've ever had, and 1 being no pain at all. At this, how bad is this pain?
I rate 6 to 7.
And is it 6 or 7 all the time?
Yes, whenever it acts up.
Okay, and how often in a day does that happen?
2 to 3 times.
Okay, and did you notice any pattern to that at all? Is there anything that makes it feel better for you?
When I take mefenamic acid, it relieves the pain temporarily, but it doesn't get rid of it.
Okay, and does anything that makes it worse?
When there's a sort of exertion.
Okay. And is there anything else that's been going on at the same time? Any other symptoms that happening anywhere else other than when the pain is happening there?
No.
Okay. And what else have you tried to alleviate the pain other than taking the mefenamic acid?
During the time of the incident, I immediately put an ice on the top of my knee, but the pain is still there.
Okay. And it sounds you've talked a little bit of how it's impacted you in your doing your household chores and in your walking. It burdens you to walk. So any other impact of it on your life?
At the middle of the night, when I'm going to the bathroom, it burdens me, and the pain is still there.
Okay. And does it wake you up at night?
It doesn't, but it troubles me back to sleep.
Okay. And what do you think it is?
I'm not sure, but I guess it's a cold muscle.
Okay, that's all I want to ask regarding of your chief complaint and your history of present illness. The next part of the interview is the past health history. This portion focuses on questions related to clients' past. So the information gained from these questions assist us, nurses or student nurses, to identify risk factors that stem from previous health problems of the patient. Okay, Nadette, now we're going to talk about your past health history. And what I want to talk about here with you are the things that have happened in the past with you. Diseases or illnesses that you can remember that you had in your childhood or when you were a child. Would that be okay with you?
Yes.
Okay? And as an adult now, thinking back to your childhood, is there any illnesses or diseases that you are diagnosed back then that you are diagnosed now as an adult?
No?
Okay. And did you have a normal childhood? Or did you have a childhood illnesses and were you vaccinated against them?
I've been having a normal chickenpox during my childhood, but no vaccination.
Okay. And have you ever had surgery?
Yes, I'm having a cesarean operation during I give birth to my daughter.
Okay. Have you ever had any major injuries that took you to the hospital or made you seek medical care?
No?
Okay. Ever been in hospital or ever been admitted to the hospital other than when you were born or when you gave birth to your daughter? No? Okay. So, you don't have other illnesses like diabetes?
No?
Okay. Heart failure?
No?
Asthma?
No?
Okay. So I suppose you don't have a maintenance medications.
No?
Okay. Are you up to date to all your immunizations?
Yes, I'm completed with
Okay.
my immunization.
Are you allergic to any medications?
No?
Okay. And are you allergic in anything else? In food or pets?
No?
Okay, Nadette, are you still having your menstrual period?
Yes, I'm having a menstrual period in the first week of the month.
Okay. First week. So, is your period regular or irregular?
It's a regular.
Okay. And have you experienced any miscarriages?
No?
Okay. Do you have any reproductive problems?
No?
And that's all I want to ask. Okay. The next part of the interview is the family health history. So here, this is an exploration of any disease of the patient's family that may influence their health. So here we're going to explore if the patient or the client has a hereditary diseases or genetically based diseases. Okay. Now that what I want to talk, we're going to talk about your family health background. So do you have any concerns about illnesses or diseases that run in your family or problems that you think exist in your family history? And what I meant by family is I'm talking about your parents, grandparents, and your children. Would that be okay with you?
Yes, it's okay.
Okay. And now, are your parents and grandparents your biological parents?
Yes.
Okay. And do you have any concerns about any illnesses?
No.
Okay. Can you tell me about any problems that your parents and grandparents had in terms of their health?
My mother was diagnosed recently having hypertension and arthritis.
Okay, I can. Okay. And can you tell me how old is your mother now?
68 years old.
Okay. Your daughter, does she have any health problems that you're aware of?
No.
Okay. Okay, aside from those diseases that you have mentioned, is there any other illnesses that affected your family?
No.
Okay.
Nothing.
Actually, that's all I want to ask in terms of your family health history. Okay, Nadette, now we're going to talk about your social background and current lifestyle. So this is where I'll get to know more about you as a person. And some of the questions here, or the things that I will ask here to you, are a bit personal. So would that be okay with you?
Yes.
Okay, and you always have the permission to refuse to answer me if you'd like. If for some reason you are uncomfortable in answering something, so just let me know. Okay, to start with, what is a typical day is like for you? Describe it for me from the time you wake up until your bedtime.
Early morning, I woke up at around 4 p.m. preparing breakfast for my working husband and student. After that, doing house chores inside our home. Then preparing lunch. After that, taking a nap, watching TV, then preparing again for dinner. After dinner, I'm assessing my student doing her homeworks and school activities.
Okay.
That's my routinary.
Okay, all right. So I'd like to know more about your diet. Can you tell me what is you usually eat for meals and snacks in a typical day?
During breakfast, I usually eat rice with fried fish and egg. Then snacks, sometimes bread. Then during lunch, I cook some meat like pork or chicken. Then during dinner, I usually cook vegetables. Sinabawang isda, and then with fruits.
Okay, that's great to know. So you've mentioned breakfast, lunch, and dinner. So you eat 3 times a day,
Yes,
not including the snacks.
yes, not including snacks.
So you snack in the morning.
Sometimes in the afternoon.
Okay, and regular exercise. Do you exercise?
Yes, I spend exercise in a week.
Okay, and how often in a week do you exercise?
Twice a week to maintain my physical condition.
And can you tell me what kind of exercises? Can you give me an example?
Basic body stretching, head with my shoulder, arm, leg, hips, then jog run.
Okay, all right. It's great to know that you had time to exercise because I highly encourage my patients and family and friends to exercise as it improve and boost the immunity that is good for our health. And it's also good that you've incorporated fruits in your meals. Okay, now tell me about your sleeping patterns. Are you sleeping well or are you having trouble sleeping?
No, I don't have any problem with regards to my sleeping time during nighttime. I sleep well.
Okay, all right. And how much or how many hours of sleep do you get a night?
Nighttime, I used to sleep 6 to 7 hours.
Okay, 6 to 7 hours. Are you feeling tired when you wake up in the morning?
No, I'm energized.
Okay. And do you nap during the day?
Yes, exactly.
And does that make you feel refreshing?
Yes, it makes me relax and feel energized.
Okay. And now, can you tell me about your tobacco use? Do you smoke?
No, ever since I don't smoke.
Okay, that's great to know that you haven't gotten into smoking. Okay, that's great. And now, can you tell me about your alcohol use?
Sometimes a little bit of beverages when there is an occasion.
Occasionally. Okay. So, any recreational drug use?
Absolutely no.
Okay, that's great. No? Do you take vitamins or herbal supplements?
Yes, I used to take Energon C for my vitamins.
So, and now I'd like to know a little bit more of your living situations. Any exposure to things like smoke, fumes, chemicals, radiation, or loud noise?
Sometimes loud noise.
Okay, sometimes. At home, is everything all right? Any stressors?
No, it's manageable.
Okay, okay. Okay, that's actually all the things that I want to ask from you. So what I'd like to do now is just kind of go through all the things that you have told me and summarize for you. Because this is the information that I want to take to Dr. Villanueva, so I want to make sure that I have it all correct. So if I've forgotten something or I have gotten something incorrect, so please let me know, okay? Okay, so here it is. You came to the hospital today for a complaint of a left knee pain, and it's pain that you mostly noticed when you were bending or using it in some capacity. It's a throbbing pain that happens randomly, but it does happen 2 to 3 times a day. It's going on for about a week now. It started when you're having your gardening, you've lost your balance, then you fall. It's about 6 to 7 on a pain scale. You report that the pain wraps around the joint, and you've taken mefenamic acid to alleviate the pain, but it only relieves the pain temporarily. Also tried some ice. That hasn't really helpful. It's getting in the way of your daily activities, like doing household chores and in walking. It doesn't really keeps you up at night, and you think this could be a pulled muscle of some type. Okay? You had a cesarean or C-section surgery when you gave birth to your daughter last 2003. You have no allergies in food and medications, and your mother is diagnosed with hypertension and arthritis. Other than those, there are no other diseases that affected your family. So is there anything else that I have forgotten or you would like to correct?
No, I think it's all okay.
Okay. Okay, thank you. Now, Nadette, I will be taking your vital signs. Would that be okay with you?
Yes.
Okay. I have observed that the client is cooperative with the interview and she speaks clearly, fluent with an even pace, and her word of choice is appropriate. Okay, Nadette, thank you very much for your cooperation. And now I'm going to head out and I'll be taking this information to Dr. Villanueva, and Dr. Villanueva will see you then. And I'll be seeing you later, okay? Okay, thank you very much.